Good morning to everybody. I would like to thank everyone for coming today to today's Agent Orange Awareness Symposium hosted by the Vietnam Veterans of Medina County, Chapter 385. Would you please stand for the posting of the colors? Sergeant of the Arms, secure the building. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Take your seats, please. My name is Jim Coolis, President of Chapter 385 of the Vietnam Veterans of America. I served in the United States Army and was in country 1968 and 1969 at a place called Phu Loy in Tu Quoc, Vietnam. I have been happily married for 42 years and have two grown children. I currently live in Brunswick, Ohio, with the hopes of retiring to a warmer place. For the past 26 years, I have been involved with Chapter 385 of the Vietnam Veterans of America. Together, we have crossed many bridges and obstacles, changed the way the Vietnam veterans are received, and left our mark in Medina County with the building of the Vietnam Veterans Memorial. Today, we stand proud with our heads held high, saying, "I'm a Vietnam veteran and proud of it." Through all these years, the one issue we've never been able to overcome or understand is the Agent Orange issue, named for the orange striping on the barrel. We know what it has done to us and what it will do to future generations. Over the last 40 years, hundreds, if not thousands, of independent research reports have been submitted to correct the delay in the nation's treatment of veterans who were exposed to dioxins, Agent Orange, during the Vietnam War. Many veterans began reporting high rates of illness and disability soon after their wartime service and have waited many years for a fair resolution to their concerns. These concerns now extend to health problems among our children and grandchildren. Today's Agent Orange Awareness Symposium is not intended to resolve those issues. Our intent is solely to bring awareness and try to understand what has happened and what needs to be done today. Waiting for an army to die is not the answer. We cannot allow this issue of Agent Orange to be buried for another 40 years. We have to bring it from the past into the light of today. Asking for a resolution, pushing for answers is the only way we can ever put this to rest. If not for us, then for our children's children. By solving the Agent Orange issue, not only will we be helping ourselves and our children, we will also ensure that the soldiers of today will be cared for properly, and they are also facing many of the same problems we have. We will not abandon another generation of veterans. This morning, our first speaker will be Joe Destro of VVA 385 to explain what is Agent Orange. Joe?
My job today is to try to explain to you what Agent Orange is. I'll start out by saying I'm not a chemist. If I mispronounce some of these words, forgive me. That's why I have a PowerPoint behind me, okay, so you can read them better than I can say them probably. But I am a Vietnam vet. I served in Vietnam from 1969 through 1970, the beginning of 72. Okay. There's three parts to my presentation today. Okay. One, to try to explain to you in layman's terms what Agent Orange is. Secondly, is going to be to try to explain to you why Agent Orange is toxic, because it wasn't designed that way. And thirdly, to try to explain how the toxins in Agent Orange are affecting us and possibly our children and their grandchildren. Okay, so let's start out first by saying, what is Agent Orange? Okay, to begin with, it's a combination of two synthetic chemical compounds. Okay, the first is a chemical compound. It's a three-part synthetic oxin known as chlorophenoxyacetic acid, and its technical name is 2,4,5-T, or trichloride phenoxyacetic acid. It has a code name. The code name of this product is herbicide orange. This product was first produced in 1940 as a weed control to help stimulate food production. Okay? The second active ingredient in Agent Orange is a two-part synthetic plant hormone. This product is a 2,4-D, okay, chemically known as a dichlorophenoxyacetic acid, and its code name is Agent LNX. This particular product, Agent LNX, was first used and developed in 1946 by the British during World War II, and it is also designed to help promote the production of food crop, okay, at that period of time. So both of these products are what are called defoliants, okay? They're designed to kill off weeds, okay, so they don't take the nutrient from the soil, so the crops will grow better. Take these two products, and let's see, take these two names, we combine them, and we take Agent from Agent LNX, and then the orange from the herbicide orange code name, and voila, we have a new product and a new code name, Agent Orange. Okay, those are the only two synthetic products that went into the manufacturing of Agent Orange. By themselves, neither of these products are harmful. Okay, and combined, they're not harmful. Okay, so if that's true, okay, why are so many veterans, okay, coming up with illnesses, and why do we have, and why was there nothing that came out prior to the Vietnam War? They've been used since, one since 1946 and the other since 1942, okay? Well, it turns out that beginning in 1962, okay, in Vietnam, the U.S. used, I lost my spot here, I apologize, okay? The U.S. used 20 million gallons of Agent Orange in and around Vietnam, okay? This high concentration of use of this product is what caused these illnesses to become noticed and effective, okay? The problem with Agent Orange is not the chemicals that are used to make it, but what happens in the production of Agent Orange is that during the production of the first compound, herbicide orange, the 2,4,5-T, improper heat controls create a third synthetic chemical. This synthetic chemical is known as 2,3,7,8, or its chemical name of tetrachlorodibenzoxidine P. Dixon, okay? Short, it's TCDD, okay? TCDD, it's important to keep in mind, has never been intentionally produced, okay? It was through the research after so many Vietnam veterans became ill, and they started trying to find out why, that they realized this is a new chemical within Agent Orange that wasn't intended to be there, okay? The question was why? Well, the improper heat controls become the issue. When it was produced early on, it was produced in small quantities, okay? So the heat control was more stabilized. During Vietnam, they started producing it in massive quantities, therefore not having quite as much control over the production of the product. And the chemical 2,3,7,8 became part of the product, okay? What is 2,3,7,8? It's in the sense it wasn't intentionally produced. That's kind of like, I'll refer to it as alcohol. We all know that if you eat a bunch of grapes, you're not going to get drunk. And if you eat different grains, you're not going to get drunk. But the natural process of fermenting, for instance, grapes or grains, creates alcohol. Alcohol is a natural byproduct of the process of the fermentation that goes into creating it. Unlike alcohol, which is produced intentionally, okay, the TCDD happened unintentionally. But it's a natural byproduct of the production of the herbicide orange when heat control is not very strictly controlled. Okay? So when they first started coming out with the problem, there was no issue with Agent Orange because in itself, neither of the substances that go into Agent Orange are toxic. And it was not until a lot of people started getting sick and research started being done that TCDD was discovered in the product. In I lost my place again. Okay, in 1970, the Department of Agriculture halted the use of 2,4,5-T, okay, or herbicide orange, from all use in crops in the U.S. with the exception of rice for some reason. And then in 1985, okay, the EPA terminated all use of 2,4,5-T in the U.S. Okay, so they actually stopped manufacturing it here in the U.S. in 1985. And keep in mind, it's important to note that until they started the research on Agent Orange, 2,3,7,8 was never produced intentionally. It wasn't until they started doing studies that they intentionally produced that product to see what it was in research. Okay? And then once they found out what it was, then that's when the production of 2,4,5-T became halted. So, now we know what Agent Orange is. Now you know why it's toxic. Okay? Next problem is, how does that product affect us? Okay? Our immune systems are all designed, okay, to help protect ourselves against organisms that come into our body. And there is a part of every living organism cell that contains what are called AH receptors. Okay? These AH receptors in our cells, their functions are to protect our bodies from other toxic substances. Okay? So what happens with TCDD? And why did it become prevalent in Vietnam? Well, large amounts of TCDD, okay, overwhelm the AH receptors within our cells, which causes them to malfunction. The malfunctioning AH receptors in our cells then leads to other medical issues because they are not functioning properly. Okay? Extremely high doses of TCDD go a step further. Besides the malfunction of the AH receptors, they actually damage our cells, which in turn long-term effects are they damage our DNA. Our damaged DNA is what creates a problem not only for us, but for our children and possibly their children, because it's this damaged DNA that we pass, pass on to our children. And they can possibly pass it on to their children. Okay? So that's why the product becomes so crucial for us to understand how and why. And hopefully that sometime in the future, they will understand that the conditions of some of our children and grandchildren are related back to the Agent Orange that had the TCDD within it. Okay? All of our bodies are different. All of us process things differently. So it's important to remember, while this, for everybody that was in country and exposed to Agent Orange and the TCDD, we were all exposed at different quantities, okay, at different times, in different ways, okay. Some of us that were there ate food, okay, that was contaminated with the product. We may have a higher exposure to contamination of the TCDDs. Others of us may not have had that exposure. So it affects everybody differently in a different way. And it's also going to affect not only our children, but our grandchildren differently, depending on the makeups of their bodies. Okay? So once again, I hope that I was able to put a little bit of light on this. That's my 5 minutes. I hope it brought a little bit of light to the subject. Thank you.
Our next speaker, Ron Euler, also a VVA Chapter 385. Ron?
What makes Agent Orange hazardous? Veterans who served in Vietnam between January 1962 and May 1975, and Korean veterans who served along the DMZ in Korea in 1968 and 69 have a high probability of suffering from a variety of health conditions. A substantial amount of scientific and medical research has shown that Agent Orange and other herbicides containing dioxins were used to defoliate vegetation in the jungles of Vietnam and fertile fields. Agent Orange was used in rice paddies in order to deny the enemy food supplies, and was also used in the perimeters of military bases in order to provide a clear line of fire. After several years of advocating by the Vietnam Veterans of America, Congress enacted into law the Agent Orange Act of 1991 to study and research the long-term health effects on Vietnam veterans. This empowered the Veterans Administration to declare presumptive exposure to dioxin and enabled Vietnam veterans to begin receiving treatment and compensation for health conditions related to Agent Orange. The Agent Orange Act of 1991 also empowered the National Academy of Science and the Institute of Medicine to conduct research regarding the long-term effects and diseases that could result from exposure to Agent Orange. The results of their research made public in 2006, 2008, and 2010 have brought us to where we are today. That is, making all of us aware of the dangers that we face today and the generations of the future. It is important to note that all of the recommendations made by the National Academy of Science and the Institute of Medicine made in 2006, 2008, and 2010 have never been acted upon, and further research that is needed has not been properly funded. For example, in 2006, an analysis of 22 studies conducted showed that an exposure to Agent Orange appears to be associated with an increased risk of birth defects. One New Zealand study of veterans exposed to Agent Orange found that there were significant levels of DNA damage induced as compared to unexposed veterans. We will hear from several professionals today about the various diseases and effects that Agent Orange could have on the men and women who served their country so honorably. not knowing that several years later we would be faced with the ailments from its use. I do not believe any one individual who served was ever made aware at the time of the dangers of this defoliant. It has taken many years of persistence by the Vietnam Veterans of America and the Veterans Administration to finally bring this issue to public awareness. The point I want to make here is that nothing will happen unless we make it happen. As it stands today, when the taps blow and the last Vietnam veteran is placed at rest, the legacy of Agent Orange will live on in our children, their children, and possibly many more generations. Thank you.
And now our next speaker, John Birdsell from the Parma VA, will speak on illnesses and diseases connected to AO and birth defects that are recognized by the VA. John?
Good afternoon. My name is John Birdsell, and I'm a physician assistant, and I've been working with the Department of Veterans Affairs since 1996. I'm a proud VA employee, and every day I go into work to serve our veterans that have so proudly served our country, and to me that's an honor, and I thank you all for that. Before I start into my lecture, I just want to let you know that if you go onto the VA's website, there's quite a bit of useful information. For all those who are not computer savvy, I have put together a complete packet which has facts, the Agent Orange Acts, exposures, presumptives, the Agent Orange Review, and a great deal of useful information. So if you're not computer savvy, there's a stack of these out in the lobby, and you're more than welcome to take them. In addition, I also put the name and information of our contact person. So if any of you would like to be put on the Agent Orange registry, there's a name and number of who to call and schedule an appointment to be put on that free registry. I'm a little shorter. So I'm going to talk about some of the diseases that are considered presumptives and associated with Agent Oranges. The first thing I'd like to say is I'm going to break this down to conditions, essentially the diagnosis, the definition, what exactly it is, the symptoms, the subjective complaints that might bring you to your provider, and of course the diagnosis. How is it actually diagnosed? The first condition is AL amyloidosis. This is a rare disease when amyloid proteins are abnormally deposited in the tissues and organs. Primary amyloidosis is the most common form. Although it's not a cancer, it can occur because of some cancers. As with many of these conditions, the symptoms will vary on the organ systems that are involved. For some, only one organ system, while for others, there can be multiple organ systems, to include the heart, liver, kidneys, bowels, skin, nerves, joints, pretty much everywhere. And because of that, you can get a variety of symptoms, a lot of nonspecific symptoms: fatigue, anemia, unexplained weight loss, shortness of breath, numbness and tingling in the limbs. It's for this reason, when you have symptoms and when you have problems like this, you go see your physician. In the end, this is actually diagnosed by a biopsy. The next condition is chronic B-cell leukemias. Hairy cell leukemia is actually a subtype of CLL, which is chronic lymphocytic leukemia. The reason I mentioned hairy cell leukemia is that was one of the previous presumptive conditions, and now it's all looped under the chronic B-cell leukemias. Leukemia is a cancer of the blood cells. The B cells are a specific type of lymph cell, I've been drinking too much Pepsi, that affect a body's immune system. There's two types of B-cell leukemia. There's PLL and HCL. Chronic lymphocytic leukemia is the most common form of leukemia and is characterized by production of excessive number of white blood cells. And again, with many of these diseases, a wide range of symptoms and physical lab or abnormalities may be present at the time of diagnosis. Most who end up going to see their physicians go because of painful swelling and cervical lymph nodes. Sometimes these can be present for a great deal of time, and they can kind of come and go, but don't totally always disappear. Symptoms can also include extreme fatigue, weakness, fevers without signs of infection, night sweats without signs of infection, frequent infections, unintentional weight loss, lymph nodes, enlarged liver or spleen, easy bruising or bleeding, petechiae, and bone point or tenderness. It's interesting that actually 25% of these people will have absolutely no symptoms. And again, like many other things, initial labs, then with a follow-up biopsy is how this condition is diagnosed. The next condition is chloracne, or similar acneiform disease. Chloracne is an acne-like eruption of blackheads, cysts, and pustules associated with overexposure to certain compounds. These lesions are frequently found on the cheeks, behind the ears, in the armpits and groin area. Many of us go through this in puberty. For some, it never really goes away. The symptoms basically are the lesions of the body, and pretty much for diagnosis, it's a visual diagnosis, although sometimes it's very difficult for a physician to distinguish chloracne from other dermatologic conditions. And for that reason, again, that's where I believe a dermatologist needs to be involved to get a definitive diagnosis. The next condition is type 2 diabetes. This is a chronic disease that affects the body's ability to use blood sugar for energy. In type 2 diabetes, the body does not produce enough insulin, and the body's cells ignore the insulin that it produces, and this is known as insulin resistance. This is different as compared to type 1 diabetes. With type 2 diabetes, you can be completely asymptomatic. I can't tell you the number of patients who've come into my office, and I did some labs just as a routine screening, ended up diagnosing them with type 2 diabetes. Sometimes, especially if the diabetes has gone on for a while, patients can become symptomatic. The usual symptoms are excessive urination, excessive thirst, weight loss, sometimes excessive hunger, which I happen to have a lot of, but not diabetes. Even blurred vision, impairment of growth, and susceptibility to certain infections also might accompany chronic hyperglycemia, which is diabetes that has not been diagnosed. The important thing is also, when you're having these symptoms, is to have it diagnosed. Diagnosis can be done by 2 or more finger sticks of 126 or above, and these have to be fasting, no food for 8 hours before. Or you can have symptoms of hypoglycemia, which I've already noted, with a random glucose of over 200. A glucose tolerance test is also used when the diagnosis is in question. This is actually where somebody is given a bottle of juice is called glucola. It's usually orange or root beer, and it's really disgusting and nasty. But you drink that, and then after 2 hours, we check your blood sugar. If your blood sugar is over 200, that is also used as diagnosis for diabetes type 2. There is another test which is a little bit controversial called the hemoglobin A1C. This test is normally used to follow people that are already diabetics, but this is actually coming down the pike to be used as diagnostic. A hemoglobin A1C of 6.5 will be in the near future considered diagnostic for diabetes mellitus type 2. The next condition is Hodgkin's lymphoma. This was formerly known as Hodgkin's disease. This is one of 2 common cancers of the lymphatic system, which is actually part of the immune system. Helps you fight off infection. The more common cancer of the lymphatic system is called non-Hodgkin's lymphoma. A malignant lymphoma cancer is characterized by progressive enlargement of lymph nodes, liver, spleen, and progressive anemia. Symptoms with classic HL can present with painless, localized peripheral lymphadenopathy. Again, painless lymph nodes or even painful lymph nodes in the neck. Usually this is where they occur. They occur with the neck. A patient will come in and say, I have these lumps, otherwise I feel great. That's the typical presentation. Obviously, if the disease has progressed, you can get more serious symptoms and disconcerting symptoms, which would include fever, fatigue, weight loss, itching, loss of appetite. And again, in addition to these nodes being in the neck, they can always be in the arm and the groin. As with most of these other conditions, a biopsy is the definitive diagnosis. The next condition, which is known as ischemic heart disease, this was recently added as one of the presumptives. It is also known as coronary artery disease or atherosclerotic heart disease. This is actually a result of accumulated plaques within the walls of the coronary arteries. This is blockage. These arteries supply the myocardium, which is the heart muscle. The heart muscle needs the oxygen and nutrients. If it doesn't have those, it becomes compromised. The disposition of the plaque in the lumen, which is this free space in the artery, is what the heart needs for the flow of nutrients and oxygen. Ischemia means the amount of blood supplied to the tissue is inadequate to meet the needs of the tissue. Ischemic heart disease is coronary artery disease. However, it's coronary artery disease that has progressed to a point at which it compromises that blood flow and oxygen to the heart. It's at that point where interventions need to be made. Coronary artery disease can have no symptoms. If you have a very minor blockage, you might feel perfectly well. If it gets to a point where you actually do start having symptoms, you might have chest pain. You might have jaw pain. You might even have a tightness or squeezing in the chest. Sometimes patients will have neck pain that radiates into the jaw or shoulder or arm. Classically, it's always the left arm, but I've seen it many times with patients in the right arm. Also, patients might come in saying, I just have a little heartburn, doc. No big deal. Give me a Zantac. Maybe even a little bit of nausea. The interesting thing is the number one symptom for somebody coming in with a myocardial infarction is nausea. So it's important when someone comes into your office that you do properly evaluate and look at other risk factors, because you don't want to give somebody Tums if they're having a heart attack. The diagnosis can be made a number of different ways. There's MRI imaging of the heart, which will show the blockage. There's obviously a stress test. Unfortunately, a stress test, you can have a positive stress test. So here we are, we think that we have a problem, and it turns it's not an accurate test. Blood tests, when someone is having a myocardial infarction, can prove that there is ischemia. But in the end, cardiac catheterization is going to be the gold standard. That's going to diagnose the blockage. That's going to let us know if medical therapy is appropriate, or putting a stent is appropriate, or a bypass. So in the end, the gold standard is going to be a cardiac catheterization. The next condition is multiple myeloma. Multiple myeloma is a cancer caused by the overproduction of certain proteins from white blood cells. It's called multiple myeloma because it's characterized by plasma cell tumors in bones in multiple parts of the body. The interesting thing about multiple myeloma is it can have absolutely no symptoms until the degree the disease possesses or progresses. Symptoms can include bone pain, unexpected bone fractures, repeated infections, weakness, numbness in the legs, fatigue, generalized weakness, unexplained weight loss. As you can see, a lot of this is actually very vague. That's why it's important when you're having these symptoms that you go see your provider. There are certain things that we look at when someone comes in with generalized symptoms that we look at that can give us the hallmark of multiple myeloma. Elevated calcium levels, elevated protein levels, all these things will lead to that diagnosis before someone even progresses to the point of these symptoms. And of course, the labs are the initial, and then x-rays, imaging studies, and of course, in the end, the diagnosis is going to be made by a biopsy. The next is non-Hodgkin's lymphoma. This is a type of cancer of the lymph glands and other lymphatic tissue, which is part of the body's immune system to fight infection and disease. The clinical presentation varies depending on the type of lymphoma and the areas of involvement. Progression can be really, really slow. It can be relatively inactive and sluggish and actually go on for years. On the other side, it can actually move very quickly. Symptoms could include, again, painful lymph nodes in the neck, armpit, or groin in the early stages. Other signs, usually during the later stages, are going to be the typical fevers, night sweats, fatigue, weight loss, abdominal pain, swelling, chest pain, trouble breathing, itchy skin. Again, a whole host of symptoms that need to be narrowed down by your physician and would warrant lab work, imaging, and then the proper diagnosis. Of course, the final diagnosis is also, again, a biopsy. The next condition is Parkinson's disease. This is a chronic progressive neurodegenerative disorder characterized by any combination of 4 cardinal signs: resting tremor, rigidity, bradykinesia, and gait disturbance. A great way to remember this is TRAP, Parkinson's trap. This is how most medical people remember it. T as in tremor. This is a tremor at rest, uncontrolled, shaking. This is not an intention tremor. Intention tremors are called benign essential tremors, are when you do a purposeful movement and your hand is shaking. This is actually a resting tremor. R, rigidity, stiff muscles. A, akinesia, which is slowness or absence of movement. Most people with Parkinson's, you'll see that they'll move very, very slow. And of course, P, postural instability and impaired balance. Symptoms can include resting tremor or trembling in the hands, arms, jaw, legs, face, rigidity or stiffness in the limbs and trunk, generalized slowness of movement, that's the bradykinesia, and of course the impaired balance, which is postural instability and coordination. One of the challenges with Parkinson's is there's many other disease processes that have Parkinson's-like features. There's vascular dementia, Lewy body dementia, and there's a great deal of overlap. You can have more than one of these conditions. Unfortunately, the practical diagnosis for Parkinson's is one of clinical impression. There's no blood test. There's no physiologic test. There's no imaging that I can do to say, oh, you have Parkinson's. It's actually mainly made by a good history, a good physical exam. Bradykinesia plus one of the 2 other cardinal manifestations, tremor and rigidity, must be ordered or must be present to make the diagnosis of idiopathic Parkinson's disease. Idiopathic means that it has no identifiable cause. There are forms of Parkinson's which are secondary to other causes. So again, here's where you have the overlap, here's where you have the confusion. In addition, most patients with Parkinson's are put on dopaminergic therapy, and a positive response to this therapy actually helps confirm the diagnosis. Because of the complexity and the similarity with other disorders which are similar to Parkinson's, the proper person who should be doing a diagnosis of Parkinson's is a qualified neurologist. The next condition is peripheral neuropathy, and I put in here acute and subacute early onset. Essentially, peripheral neuropathy is a condition of the peripheral nervous system, which consists of the nerves outside the brain and spinal cord. The acute or subacute, the early onset form of peripheral neuropathy, refers to symptoms occurring within weeks of exposure. For peripheral neuropathy in Agent Orange, the symptoms are going to occur relatively quickly. They're not going to occur years later. At one point, it was thought that this neuropathy would in fact resolve after a couple of years. However, subsequent studies have showed that is not always the case. A hallmark is still developing the neuropathy within weeks of exposure. Symptoms for neuropathy can be numbness, tingling, prickling in the hands, fingers, toes in the early stages. It can actually progress. You can have pain, throbbing, shooting, and it can be very significant, most notably worse at night. What a lot of people don't understand is during the day you're busy, you're running around, you're not really thinking about things. At night, you're in your bed, your eyes are closed, and then you're really noticing the symptoms. And that's when most people complain about the neuropathy. They tell you, Doc, it's not so bad during the day, but I lay down at night, it burns. That's when most people will really notice it. Or they'll come in and say, my feet are so sensitive, I can't put a blanket on my toes. That is actually known as dyskinesias, which is a painfulness or disagreeableness of any sensation not normally painful, which means you touch this. That shouldn't hurt, but it does. And that often happens with peripheral neuropathy of the lower extremities, and that's often noticed at night when people put their blankets over their feet. Obviously, other symptoms include throbbing, muscle weakness, and of course, if it progresses, a loss of balance or incoordination, which is, again, similar to Parkinson's but different. The diagnosis of peripheral neuropathy can usually be made with a history and physical exam in addition to blood tests. There are other testing. There's something called an electromyography and nerve conduction study test. If I ordered these on you, you would not like me. This is where we put needles in and send electricity through. It is not the funnest test. But sometimes to get a definitive diagnosis, that's what we have to do. Because that can clarify, is the neuropathy truly neuropathy, or is it a pinched nerve from an elbow or neck or back? Sometimes in rare cases, we actually have to do a biopsy of the nerve. It's important to note there are multiple causes of peripheral neuropathy. So again, a good, thorough history and physical exam and blood test is needed. Patients with diabetes, one of the complications of diabetes is peripheral neuropathy. So all that has to be taken into account when you're evaluating somebody for neuropathy. The next condition is PCT, porphyria cutanea tardia. Not bad. This is a disorder by liver dysfunction and by thinning and blistering of the skin in sun-exposed areas. It was interesting because there was a huge breakout in the 1950s with exposure to hexachlorobenzene, and this was actually in eastern Turkey. Next slide. The symptoms include blisters on the area of the skin exposed to the sun, such as the face, arms, and hands, followed by crusting and scarring, hyperpigmentation, increased hair growth on areas exposed to the sun, and liver damage. Again, the diagnosis is a good history and physical exam in addition to blood work. Unfortunately, many dermatologic conditions mimic one another. So in the end, most dermatologists will look and say, it could be one of all these things. And of course, they want to take a biopsy. That confirms the diagnosis. Next slide. Okay. The next condition is soft tissue sarcoma. This is other than osteosarcoma, chondrosarcoma, Kaposi sarcoma, and mesothelioma. Definition: different types of cancers in body tissues such as muscle, fat, blood, and lymph vessels and connective tissues. A sarcoma is a cancer, but it arises. Operator error. Okay, we're going to go to the prostate. Okay, well. Okay, I guess now we're going to talk about prostate cancer. Prostate cancer is obviously cancer of the prostate. Usually with prostate cancer, there really are no symptoms. Most of the time, it's found with an elevated PSA. That's about 80%. About 20% is found through an abnormal digital rectal exam. Urinary frequency, urgency, nocturia, and hesitancy are seen commonly, but they're usually related to benign prostatic enlargement. Benign prostatic enlargement actually occurs with most men, about 80% over the age of 50. Again, this is not usually a symptom of the prostate cancer. However, blood in the urine, blood in the sperm, those can be actually manifestations of prostate cancer. Most prostate cancer is found through a PSA, which is a screening tool. There's a bit of controversy with the PSA. Next slide. Yes, this is kind of busy, but basically what this boils down to is the PSA in and of itself was originally designed to follow people who had already been diagnosed with prostate cancer, and it was to follow the progression of the disease. The problem with the PSA is it's not an absolute PSA. Individuals can have elevations in their PSA from a prostatic infection, like chronic prostatitis, or calcification of the prostate. Someone comes into the office, they have, excessive urination, nocturia. Oh, let's do a PSA, and it's elevated. That, by and large, buys them a biopsy. Biopsy can come back completely negative, again, if they don't have the prostate cancer. Caveat, and one of the problems there is when we do a biopsy, we can't get the entire prostate, so we only get a small piece of it. So you can have a negative biopsy and still have prostate cancer. And so that's one of the things you need to be very aware of, and that's one of the problems. So you have a negative biopsy, symptoms progress, your digital rectal exam is completely normal, but then your PSA starts going up. This is probably going to buy you another biopsy of your prostate.
And again, this is one of the controversies behind doing it. Usually when somebody has an elevated PSA, the first thing we do is we schedule them for a biopsy because we look at the worst case scenario. But you have to take it with a grain of salt. The PSA test in and of itself is controversial. Part of the problem is prostate cancer is also a very slow-growing cancer. So unless you have a 10-year survival rate, why would you do a PSA on somebody who has multiple medical problems if they're 86? The treatment is not going to prolong their life. In fact, their quality of life is probably going to suffer if they go through like radiation therapy, chemotherapy, or even have their prostate out, which of course opens up a whole can of worms with complications from having a prostatectomy, to include urinary incontinence and the like. Next slide. And now we're going to talk about respiratory cancers. These are cancers of the lung, larynx, trachea, and bronchus. Definition: these are cancers. Symptoms can vary. It really depends on the location of the cancer. Unfortunately, sometimes, especially in the early stages, you might not have any symptoms. Lung cancer, something as simple as a cough that doesn't go away. Coughing up blood, that is a red flag. Although 85% of all the men who come in my office who say, I cough up blood, it's acute bronchitis. However, coughing up blood is something that warrants a visit to the physician, physician assistant, nurse practitioner. It does warrant, being evaluated. Shortness of breath, chest pain, hoarseness. Again, you can see a lot of the overlap in these symptoms. Cancer of the trachea, again, a simple dry cough, hoarseness, breathlessness, difficulty swallowing. Cancers of the larynx, at the top of the trachea, hoarseness, voice changes, sore throat, earache, feeling of a lump in the throat. Cancer of the bronchus, cough, chest pain, coughing up blood. The diagnosis depends on the cancer. And again, what it boils down to, initially will be labs, some imaging studies, first an x-ray, then a CAT scan or MRI. But in the end, the diagnosis is going to be made by a biopsy, because that's going to actually stage your cancer and look at treatment options. Next slide. Okay. Soft tissue sarcoma. Soft tissue sarcoma, other than osteosarcoma, chondrosarcoma, Kaposi's sarcoma, or mesothelioma. This is a group of different types of cancers in body tissues, such as muscle, fat, blood, lymph node vessels, and connective tissues. A sarcoma arises from transformed cells of mesenchymal origin. The sarcomas get their name basically from the type of tissue from which they form. Osteosarcoma comes from bone. Chondro comes from cartilage. Lipo arises from fat. Leiomyosarcoma arises from smooth muscle. Next slide. Symptoms can vary, just as we've talked about with all these other processes. The first notable symptom is, again, a painful lump or swelling. As a tumor grows, it can cause many other symptoms: pain, soreness, compression by the mass. You can cause the paresthesias, the numbness, the tingling. It would cause a unilateral swelling in an extremity. This is actually how often it's found in children. They'll have a unilateral swelling, like in a leg. And when they do the imaging to see what's going on, they find a sarcoma. Rarely a patient will present with constitutional symptoms such as fever and/or weight loss. Sarcoma is something fairly simple. It's usually noticed by a painless mass that keeps getting bigger. So I implore people, if you have a lump that wasn't there before, do yourself a favor and get it checked out. 95% of the times, it's something called a lipoma, which is a benign fatty tumor. But there's always that possibility it could be something else. So when in doubt, get it checked out, get a biopsy. The faster things like this get diagnosed, especially with sarcoma, the better the outcome. Again, history and physical exam, imaging studies, and in the end, a biopsy. Next slide. Oh, good. We're getting near the end. Spina bifida, except occulta. Spina bifida is a type of medical condition in which the spinal cord, brain, or meninges are underdeveloped in a child at birth. The meninges are the protective covering around the spinal cord and brain. For presumptive conditions with children of Vietnam vets, there are 3 types of spina bifida. The first type is spina bifida occulta. This is actually not considered a presumptive. 20% of the population actually has this and doesn't know it. It is the most mild, and it can be completely asymptomatic. I can't tell you the number of patients who came in and said, I've had back pain, I do an x-ray, they have spina bifida. This is the benign form. This is what is most common. Next slide. The meningeocele and myelomeningeocele are both forms of spina bifida manifesta. Again, these are the more serious forms of spina bifida. They have physical manifestations and will have obvious symptoms if not treated. The meningeocele is the less serious of the two. These are things that will be noticed readily after birth. And of course, with these conditions, surgical intervention as fast as possible is pretty much is what's done, because you do get a better prognosis with doing that. Next slide. Again, symptoms depend on the type and the severity. A person with spina bifida may have nerve damage, paralysis, and be unable to walk, and have problems with their bowels or bladder. These are usually the 2 more latter forms of spina bifida that I spoke about that are considered presumptives. Sometimes it can actually cause hydrocephalus, which is actually fluid in the brain, and this can lead to mental retardation. The diagnosis is obvious: physical exam and imaging studies. I put this slide is more of a disclaimer. There are a number of birth defects that are associated with women's veteran service in Vietnam. These are not related to herbicides, including Agent Orange or dioxin exposure, but rather to birth mother's service in Vietnam. There's a whole list here, and unfortunately, time did not allow me to go to each and every one of these.
Veteran Service Officer will explain the term presumptive and what the AO registry is, how to file a claim, and what benefits are available to us. Ed? You got to push the button.
All right, I'm not going to stand up here at a podium, because if I stand up there for 15 minutes, you're all going to write my name in on a ballot next Tuesday. And my wife said she's not moving to D.C. and doesn't need a bigger house to clean. So, on May 3rd, 2004, myself and 92 of my soldiers landed at Fort Drum, New York, coming back from Afghanistan. The first hand my soldiers and I shook was a Vietnam veteran. You were there to welcome us home, and the 40-year fight that you've had since you've come home made sure we came home to a healthcare system that is state-of-the-art and benefits that all veterans deserve. So that's why I do what I do. I work for the Medina County Veteran Service Office. Matter of fact, Mr. Coolis is one of my bosses. He is a Veteran Service Commission here in Medina County. So if you don't like this, that's who you want to go complain to. If you do like it, go tell them you like it too, okay? Next slide, please. We're going to talk a little bit about some of the benefits that are covered under Agent Orange. If you have a disease, there is no benefit for Agent Orange. That's the first thing I want to say. Just simply coming in contact with it gets you nowhere. You have to have a disease or something wrong with you that Agent Orange caused, okay? Next slide, please. Okay, a little bit about my office, because I think it's important to understand where I come from, because if you're going to go file a claim or you want to go talk to the VA, you want to make sure whoever your representative is, you know, because there's a lot of representatives out there that, you know, you may just not want to talk to. We do several different things in our office, and this is going to be the agenda that we're going to follow. I'm going to get through this in about 15 minutes, and then when we're all done, you can ask me any question you want, okay? Next slide. Okay, what does a county veteran service office do? In the state of Ohio, and you're very lucky to live in Ohio because a lot of states don't have us, the Ohio Revised Code mandates that every county will have a veteran service office. Basically what we do is we take a veteran, a spouse, the children of a veteran, whoever it is, we find out what their need is. In this case, it's filing a claim for Agent Orange, and we hook them up with whatever agency can fulfill that need, whether it's a state benefit, a federal benefit, a county benefit, or maybe an outside benefit from another agency. And that's what we do at the County Veteran Service Office here in Medina. Next slide, please. We provide transportation to all the VA medical centers. That's mandated in Ohio Revised Code. So we go to Cleveland, Wade Park, we go to Parma, and we go to Akron. We go there every day of the week except Friday. We don't go to Akron. We only do that 4 days. We run a financial assistance program for our veterans and their spouses of the county. We also provide flag cases and free notaries for our veterans and their family members. The flag cases are for deceased veterans. If you pass away and you're a county resident, you come in, we give you a flag case. We only do it in Medina County. I can't say what other counties do. Some of those benefits that go county to county are not the same in every county. And we're accredited service officer. Now that is what you want to really remember. I'm accredited, and our office is accredited with 11 different organizations: Vietnam Veterans of America, the VFW, the American Legion, the Military Order of Purple Heart, Disabled American Veterans, the Red Cross, Ohio Department of Veterans Services. We're accredited to work with the VA, and we work very closely with the VA. My office is not a branch of the Department of Veterans Affairs. I work for Medina County and its veterans. However, I work very closely with the Department of Veterans Affairs. I have a lot of friends that work there. They are good people. That's not to say they do everything well, but they are good people, okay? And we also have a vet center here in Medina. The vet centers are a branch of the Department of Veterans Affairs. We worked very closely with the Parma Vet Center and Mr. Doc Rawlings. He comes out here 1 day a week. We gave him an office off of the square in the professional building, and he comes there and he sees combat veterans for post-traumatic stress. We have families that go in there. We have husbands and wives that go in there. We have new veterans that go in there. We have a lot of Vietnam veterans that go in there. You guys are all retiring. You've been working for 40 years, and when you retire, we all know we got a lot of time on our hands. At least I don't know that yet. I'm hoping to one day. So a lot of things are starting to come back. So we're starting to see a lot of Vietnam guys go in and see Doc Rawlings. It's free service. If you need it, contact me, contact the Parma Vet Center, and he'll schedule you an appointment. Okay, next slide. All right, this young man from the VA already went over most of these, so I'm not going to go line by line. I do want to draw a couple things up. Someone asked about how long it had to be for you to get one of these diseases in order for it to be presumptive. Every disease is different, okay? If you look up there, you'll see the chloracne, okay? Must be 10% disabling within 1 year from exposure. So if you come into my office and you tell me that I got diagnosed with chloracne 2 years ago, I'm going to say, okay, I'm sorry. If you come in and you got a diagnosis of when you got out of the service in 1971 and you left Vietnam in 1970, then I'm going to say we got something to talk about, okay? Those are the VA's rules, not mine, okay? So you got to understand the differences between law and diagnoses, okay? There's a couple more like that. Diabetes type 2. Anytime you are diagnosed with type 2 diabetes, whether it's last week, last year, 20 years ago, or next year, it is presumed presumptive. Okay, it doesn't have to be diagnosed within 1 year of your service in Vietnam. Ischemic heart disease, same way. Okay, so if you're diagnosed 2 years from now or a year from now, it's still presumptive. Next slide, please. Okay, peripheral neuropathy. That's one that I want to concentrate on for a minute because peripheral neuropathy just hit the Federal Register this past year. There are a lot of people out there that are service-connected for peripheral neuropathy on a secondary condition to type 2 diabetes. Now, what does that mean? That means that type 2 diabetes causes peripheral neuropathy. So if you are service-connected for type 2 diabetes because of exposure to Agent Orange, and a year later you become diagnosed with peripheral neuropathy, it is secondary, and they will service connect you for it. If you are diagnosed with peripheral neuropathy before the type 2 diabetes, it doesn't count. Because they say, Agent Orange does not cause peripheral neuropathy except for 1 year from exposure. So it's kind of like which came first, the chicken or the egg. Okay, and I'm not a doctor, I'm not a scientist. I don't necessarily agree with it, but if you got peripheral neuropathy in 2002 and you're not diagnosed with type 2 diabetes till 2005, they are not going to service connect you for the neuropathy, okay? We were expecting the law to come out a little bit different when it did. We were expecting them to service connect everybody with peripheral neuropathy, whether it came before or after, and they just didn't do that. That's a law change with Congress and everybody else. I know there are some people fighting it, but I just want you to understand that because that's important, because if you come in and you don't have the type 2 diabetes and you go, well, my buddy next door, he's collecting money for peripheral neuropathy, why can't I? That's probably the reason, because he had the type 2 diabetes prior to. Okay? So that's some important things to know. We talk about the Lou Gehrig's disease, okay? Didn't have to serve in Vietnam for that. Like the gentleman said, every veteran that served 90 days or more, it is a presumptive condition, okay? Next slide, please. Okay, spina bifida. Spina bifida is the only birth defect known that will service connect for someone that served in Vietnam and had a child born after that service with spina bifida, okay? Now, we talk about the women that served in Vietnam. There is, like he said, those are most of the birth defects up there. There's more than that that are service-connected and presumptive for those women. So if you were a nurse or were in Vietnam and you were a woman and you came back and you had a child and they were born with that birth defect, then it is presumptive that it was caused from your service in Vietnam, not necessarily Agent Orange. Is that clear? Everybody understand? Because that's where people get confused sometimes. Okay, next slide. Okay, for VA purposes, what is service in Vietnam? From January 9th, 1962 to May 7th, 1975, if you were in country Vietnam, it is presumed that if you come down with one of those diagnoses, that it is from Agent Orange, and the VA will compensate you for that. Now, in country Vietnam is where we get kind of confused. You had to physically step foot on the dirt in the land of Vietnam. Now, let's say you were on a boat, and let's say that boat was sinking, and two of you jumped off the boat, and one guy swam, and he reached the shore of Vietnam. And the other guy swam, and he stood up, but was still waist deep in the water, and a rescue boat came and got him and took him away back towards the ocean. Guess who wasn't in Vietnam? Okay, we're talking about geography here now. A matter of a couple hundred meters in some cases. Okay? But that's a great example, and it's used all the time by the VA of who is presumed and who is not. You had to physically get on the shores of Vietnam. A boat docked to the shores of Vietnam does not necessarily mean you were in Vietnam. You had to get it on the dock, walk ashore, in order to be presumed. Okay? That's important. Now, we talk about some brown water Navy guys up there. There are Navy people that went up into the rivers of Vietnam, and they are presumed. There's some big ships that went up those rivers, quite a few of them, a lot of destroyers. Simply going into one of the big harbors does not mean you are presumed to be in Vietnam. There are a couple court cases where the VA has come back and judges, and I say judges, not people that work in the regional office, have awarded those veterans that were in those inner harbors, because when you look at them, 3 of the 4 sides are surrounded by the country, okay? So some of them have common sense. There are also those same court cases that have gone before other judges at the VBA that they have been denied, okay? So that's something to remember when you're looking at that. Okay, testing of Agent Orange residue on planes used in Vietnam. So if you were in, let's say, Thailand, and you worked on aircraft that was spraying that stuff all over the country of Vietnam, it is not necessarily presumed that you came in contact with it, because the residue, according to the regulation, does not cause any of those diseases. It is the direct contact with Agent Orange itself, the spray. Now, I don't know, how many people in here drink? I'm sure most of you have gone out and gotten really drunk at one time in your life, and you've probably thrown up on the sidewalk, and some gets on your pants. To me, what's on my pants is not residue. It's the same stuff on the sidewalk. So, you know, that's something you got to think about with the VA. Do you want to fight something like that? By all means you do. Okay? If you got a claim where you worked on aircraft and you can prove that that aircraft sprayed, you want to fight it. Okay? So think about that. All right, next slide, please. This just goes a little bit into what in-country is. I kind of already elaborated it. If you were on a ship, you got on a small boat, you went ashore, you got some mail, you came back, you were in-country Vietnam. You flew out of Thailand. A lot of guys flew out of Thailand back into Travis Air Force Base in California. They landed in Vietnam, some of them on civilian planes, some of them on military planes. If they got off the plane and had a cigarette, or got off the plane and went and bought a Coke or whatever they had, then you were in country Vietnam, okay? Didn't have to be there long, a couple minutes, as long as you got off that plane. If your ship moored in Da Nang Harbor and your buddy got on a boat and went ashore to get the mail, he was in Vietnam. If you were docked and your buddy went down to the dock and got off the boat, he was in Vietnam, but you on the ship were not, okay? Same winds, 50 feet we're talking. But that's how the law reads. There's a huge ships list of which boats are presumptive to be in the brown water and which ones were not. That list is provided out there. Okay, so if anybody was in the Navy here, blue water guys, you want to know if your ship was up the river, pick up that list. When we talk about proving you were in country Vietnam and you're a blue water Navy guy, you have to prove you were on the ship when that ship went up the river. There's a couple different ways to do that. If they say the ship went up the river 3 times in May of 1969, and you can show orders that you were on board that ship in May of 1969, then you're good. If your ship docked in Da Nang Harbor and you say you got off that boat and went and got some mail and came back, we need to get some ship's logs, because we need to find in those ship's logs where someone wrote that you got on a little boat and went ashore and came back, okay? And we've done that. It's fully feasible to do stuff like that. Okay, next slide, please. Okay, when we talk about Agent Orange in Korea, April 1st, 1968 to August 31st, 1971, must have served on the DMZ. Those are the only units, according to the VA and Congress and the Department of the Army, that served on the DMZ in Korea. Now, we all know there was a lot of artillery units that weren't very far from the DMZ, maybe 5 miles or so, that did raids up to the DMZ. They are not on that list, okay? And that's where we run into some gray area with the VA, because we know that in the military you do a lot of things that isn't necessarily documented or, you know, there's no proof of. We know that, you know, there was artillery units doing raids up to the DMZ. If you were in one of those units and you did those raids, you want to file a claim. But you got to get buddy statements. You got to get proof, if we can go back and get records from that unit that shows that that unit went up to the DMZ. You are in a fight, okay? If you were in one of those units and you never left Seoul, it doesn't matter. You're good, because you were in that unit. That doesn't make sense, but that's the way it is, okay? Okay, it talks a little bit about if you weren't in those units, we got to get detail. We got to start looking for records. We got to start looking for information. Next slide, please. Okay, exposure in Thailand. This is another gray area for the VA when we talk about exposure in Thailand. If you were in the U.S. Air Force and you served on one of those bases and were a security guard, then it's presumed you came in contact with Agent Orange, because the only place they used it in Thailand was around the perimeters of those bases, the big air bases, and some of the smaller bases. Now, if you're on an antenna farm in Thailand, and that antenna farm is only 150 meters wide, what's the perimeter? Because it's not very big compared to an air base. But the VA says if you weren't an Army veteran who provided security around those bases, then you didn't come in contact with it. We all know that we walk over to the perimeter and we have a cigarette. We walk over to the perimeter and we talk to our buddy who's pulling guard duty, and we came in contact with it if you were over there, okay? So you're in an argument. The difference here is understanding what you got to fight and what's presumed, okay? If you were a security guard in the Army and you were on one of those air bases, it's presumed you came in contact with Agent Orange. If you were just a regular Joe over there pulling guard duty, or maybe a cook, then it's not presumed, and you have to prove it, okay? And there's some ways to do that. Okay, next slide. All right, Agent Orange outside of Thailand, Vietnam, and Korea. Anybody in here ever hear of Boca Raton, Florida? Okay, anybody know what happened in Boca Raton in the 50s? Highly top secret classified information that's all over their Chamber of Commerce website now. It was a test facility for Agent Orange and other dioxins because the U.S. government was thinking about if we went to war with the Soviet Union, we would go over there and spray all their food and they wouldn't be able to eat. And then one day it became known that we need to get all that stuff out of Boca Raton, Florida, because everybody wants to retire down there. It's going to be a nice place. So they started to move it, and there's people that went down there and moved that stuff out. There's several locations like that around the United States. There's storage locations, and there's a whole list, if you go to that website, that has where Agent Orange and some of the other dioxins were stored, and the time periods they were stored there. The problem becomes is just being there during that time is not presumptive. You had to come in contact with the dioxins, and you need to prove that. Okay, so that's where, when you're filing a claim, it becomes a battle. Okay, but just because you weren't someplace like Vietnam doesn't mean you didn't come in contact with Agent Orange. Now, if it's not on that list and you come and tell me, well, I came in contact with Agent Orange at Fort Drum, New York, or Fort Campbell, Kentucky, and it's not on that list, you need to prove it. We got to go back and go, well, why was Agent Orange there? Because everything that's been declassified says it wasn't. Okay? Next slide, please. Okay, we talk about disability in the VA and compensation. What is compensation? Compensation is a monetary amount paid to you for a direct disability caused by your service to our country. Okay? Any veteran that served and was discharged honorably or dishonorably in some cases is eligible for compensation. Okay? How much do they pay? Goes from 0% to 100%, and then there's some additional amounts that they pay in some cases. Okay? Having a 0% disability means that the VA has recognized that your disability was caused by your service, however, it is 0% disabling. Slight hearing loss is a good example. You may have hearing loss, but it may not be at the compensatable rate. So they know that you have the disability, but they're not going to give you any money for it. If you get 10%, you get a little bit of money, and then it goes up all the way to 100 and a little bit more, okay? How can you apply? You want to come see somebody like me. You don't want to go online and go to the va.gov VON app and do your claim. You don't want to just fill out the piece of paper and mail it into the VA. You want to go to somebody that knows how to file a claim, whether it's your county veteran service officer, whether it is your veteran service organization service officer, whether it's a national service officer. You want to go to somebody that knows what they're doing. Why? Because when we send in a claim, we can track it. When I send in a claim, I get a receipt that the VA received it. I know everything else I send that they receive. I know that the claim's in there, and I know what to do with it. I have to go find that claim, get access to it, and then try to fix whatever's wrong, okay? So go find somebody that, if you're going to file it, even if you go, I just want you to send this, or you need a little help, find somebody that knows what they're doing make sure they are accredited with the Department of Veterans Affairs. That's very important, okay? Next slide. Service-connected disability. What do you need for a service-connected disability? The law says you need 3 things. You need a disability. You come in and go, I was exposed to Agent Orange. I want some money. I go, what's wrong with you? Nothing. I was exposed to Agent Orange. There is no disability. You need a diagnosis from a medical doctor that says you have ischemic heart disease, or you have type 2 diabetes, or whatever, okay? Then we need an in-service event that caused that disability. If we're talking about Agent Orange, it is you were in Vietnam. That's good enough for the VA, okay? If you got type 2 diabetes, you were in Vietnam, it's presumptive. If you have a bad knee and you fell off a truck in 1972 and it's in your medical records that you went to the hospital for that knee, and I can link the two, then that's also something that we need. We have to have the disability, the in-service event, and the legal nexus, they call it if you're a lawyer. I'm not. To connect those two, okay? Okay, I put that, why is my rating only 20% and my buddy's getting 50% and he's out playing volleyball and I'm not? You know, the ratings, there's a book, there's a manual the VA goes through, and it's like, you know, real big and real thick, and they read all this stuff. Sometimes your buddy may be rated at 100%, and you may only be getting 40%, and your buddy's in better shape sometimes. It just depends on that disability. All veterans are not alike. No two are the same. They're like fingerprints, okay? And no two disabilities affect different people the same. So some people he may just be BSing you too, making you jealous thinking he's getting all that money. But, you know, some veterans get a higher rating than others based on that disability. And sometimes it's right, sometimes it's not, and we need to go back and correct it with the VA. But 9 times out of 10, things are pretty accurate, okay? When we talk about some of your legs, when we talk about not diseases, but disabilities that affect your joints, your bones, all that is based on how well you can move. And they call it flexation and all that other stuff if you're a doctor. But what happens is, as veterans and as men, and I'll say men, we're always pretty hooah and tough guys. We go into the doctor and the doctor says, well, how high can you lift your arm today? Oh, well, I can go all the way to there, knowing that it's killing you once you get to here. Okay, well, guess what? When you go in for your VA exam and you lift it to there, the doctor goes, hey, lifted arm above head. Okay? Go in there, and when it starts to hurt, it hurts. That's it. Okay? Because that's what they're going to base it on. Don't go in there if you can lift it to here and go to here, because they're going to figure that out one day anyway. But be honest with them. Don't go in there with this hooah attitude that I can do 100 jumping jacks and my heart's going to be fine, and you go out and have a heart attack. Do what you can do on a normal basis when you go into those C&P exams. Okay, next slide. All right, we already talked about presumptive. It is presumptive. There's a couple other different areas that are presumptive conditions. Former prisoners of war, there's a whole bunch of diseases that are presumptive for them. The Vietnam veterans, obviously, Agent Orange. Atomic veterans, ionizing radiation, and undiagnosed illnesses for the new veterans out of the Gulf War, the first Gulf War, okay? And all this presumptive means is if you were there and that disease is on that list, it's presumed that it came from that. You don't have to prove it anymore. Next slide. We're almost done here. Okay, if you think you came in contact with Agent Orange and you have one of those diseases on that list, or possibly a disease that is not on that list, wouldn't be presumptive at that point, but your doctor can give you some kind of medical evidence that it was caused or could be caused by Agent Orange, you might want to think about filing a claim, okay? What do you need? You need to discharge your DD-214. You need a medical diagnosis. You need evidence of presumption, okay? You can always get that later, okay? We can work on that. If you were on a ship and you know that ship went up the river and it's not on that list, and we can get those documents, don't wait to get the documents, because that could take months sometimes years, okay? Let's get the claim in. But we need to continue to work on that evidence, whether it's buddy statements, ship's logs, anything like that. Then what happens? VA gets the claim, they develop the claim, and they gather all their information. They'll schedule you for what's called a compensation and pension exam. They will order records. They order them from several different places, JUSREC, National Archives, the Department of the Army, Department of the Navy, wherever they need to go, they will go find records. And then they make a decision. And that all takes about a year, sometimes 14 months, sometimes less than a year. Now, the question is if it's granted, we're happy. We're getting money, we got my disability, I got some medical stuff going on, they're going to take care of me. If it's denied, we're not happy. What do? Do we appeal it? Sometimes yes, sometimes no. Sometimes there is no merit in the claim. Sometimes the law is just not on your side. Brain cancer, okay? Husband served in Vietnam, husband has brain cancer, son has brain cancer, never had brain cancer as family history. It's not presumptive under the Agent Orange law, but you think it was caused by Agent Orange. I can't help you. I can file the claim, I will work with you, I will get all the doctor stuff, but if it's denied at that appeal level, based on what that judge thinks, sometimes it's just not going to go through, okay? And it's very hard. I've had veterans that I've had to tell that to, and I've had spouses that I've had to tell that to. Sometimes you just can't win. And it's not necessarily fair or unfair, it's just the way the law is, okay? But don't quit. Don't quit until you get that final answer. And sometimes you need to keep going even after that. You have 1 year from that first denial to do your appeal. So when you get that first denial letter from the VA, you got 1 year to make a decision on whether you want to appeal that. There's a lot of people that will tell you, keep appealing, keep appealing, keep appealing, eventually you're going to win. In some cases, that may be true. In some cases, it may not be true, and that's why it's important to talk to somebody that does this every day, okay, and get their opinion. Go get several different opinions. It's like a medical diagnosis. Go get a couple different opinions of people that do this all the time, not just somebody that's did one claim, and see what they all say, and then make your decision from there. Continue to gather evidence. You know, if you can get, and I got to tell you, the internet is as much as I hate it sometimes, there's a wealth of evidence out there where we can contact buddies and friends that we served with 50, 60 years ago, and we can get statements, or they may have photos, or they may have documents, or they may have done the research already that can help you win a claim. I've seen a lot of claims won like that. Records from airlines that landed in Travis that flew into Vietnam out of Thailand. Those records are available in some cases. You got to do the research and you got to dig, but you can get them, and sometimes it's worth it. If you do submit an appeal and it goes up to the VBA, it is about a 2-year process. Okay, 2-year process. Backlog, 1 million claims. I think they're at what, 875,000 now or so. So there's a huge backlog with claims with the VA. We all know that's a problem. If you work with the VA like we do every day, it's a huge problem. I know it. Remember, I am not the VA, okay? Next slide, please. The last bullet on there, don't do it alone, get an accredited service officer. I can't stress that enough. Okay, why is it important to go down if you were in Vietnam and came in contact with Agent Orange and get on the Agent Orange registry? You can get a free medical exam from the VA, number one. They will see if you do have any of those diseases. It can get you into the healthcare system in some cases, no matter what your income is as far as the VA, and you can get free healthcare or healthcare with copays. But it also gets you put in their list that they build off of, and if there's any information that comes out, they can send you a letter. When the ischemic heart disease got passed, there were people, because of a little law called the Niemer rule, they went back several years and were able to pay people some money back when that law changed. And a lot of people they contacted through this registry, so that's important. Next slide, please. Now I put this one up there, which has nothing to do with Agent Orange, it has more to do with the healthcare. And why is it important to get into the VA healthcare system? Because they provide in-home healthcare for a very cheap price. If you need in-home healthcare, they will contract it for, if you're on the copay, I believe it's $15 a day. And we all know Medicare is not going to cover that, and there isn't any insurance program out there that covers that. So if you need health care, and most of you don't need in-home health care today, but 10, 20 years down the road you may, the VA is a good backup. It's a good system. You don't have to use it all the time. I encourage people to enroll in it, because when you're 86 and you've never used it and you need it, it's very hard to get somebody to that doctor to try to get them into that program if they want to get into a hospice or if they want to get in-home health care, okay? Don't wait till you need it to use it, because by then it's usually too late. Nursing home care. In some cases, they will provide nursing home care. Must be 70% service-connected or higher. If you have a service-connected disability of 70% or higher, the VA will contract your nursing home care 100%. They will pay for it at a nursing home of their choice that they have a contract with, usually within a 20-mile radius of your house, okay? If you are 60% or less, and you have to go into a nursing home because of that service-connected disability, they will also contract with it. So that's why it's important to be enrolled in the healthcare system. Next slide, please. Okay, a couple other benefits that the VA provides. I'm just going to touch on these. We all know the home loan, the education benefits. CHAMP VA, if you are 100% service-connected, you can get health care for your spouse and dependent children through CHAMP VA. If you're TRICARE eligible, though, you have to use TRICARE. Non-service connected pension for wartime veterans, and then death pension for their widows. If you served during a war, not in a war, but during a war, you could be eligible for a non-service connected pension or death pension if you're a widow. It is income-based and it is also net worth-based. So those are income-based programs. Now we talk about the DIC pension. That pension is not income-based, and that is directly related to a service member's death because of a service-connected disability or being 100% service-connected for 10 years. Now, this is important, and this is where it relates back to the Agent Orange. We have a widow. Husband died 1992. On that death certificate and on that autopsy report, it says cause of death, ischemic heart disease. Veteran never filed a claim. That widow is now eligible because ischemic heart disease is a presumptive condition of Vietnam and Agent Orange. That widow is eligible for that pension. Doesn't matter how much money she makes, doesn't matter how much money she has in the bank. So these presumptive conditions from Vietnam, if they caused the death of a veteran, going back doesn't matter how many years, the widow is eligible for benefits still. That's important to know, okay? A lot of guys died of ischemic heart disease 10, 15, 20 years ago that we're not touching out to their widows. We don't know who they are. So if you know somebody that was married to a Vietnam veteran, ask her, what did your husband pass away from? Doesn't matter when he passed away. And if it's one of those diseases, if it was one of those cancers, she needs to file a claim, okay? There are burial benefits also, okay? You know we got the National Cemetery down in Rittman. There's national cemeteries all around the country and all around the state. There are also some benefits for people that have private cemeteries that help pay for the funeral and stuff. It's not very much, but it is a little bit and can help. And then there's several different county and state benefits I'm not going to get into. But there are benefits out there for our veterans, Vietnam, whether they're from Operation Iraqi Freedom, Vietnam, World War II, Korea, it doesn't matter. There's a lot of benefits out there at the county and state level. Education benefits. That veteran passed away in 2002, and there is a minor child now who wants to go to school. Ohio has the Ohio War Orphan Scholarship Fund. Also, that fund is not just for orphans, it is also for children of veterans that are disabled at a severe rate, okay? The orphan thing kind of throws people off and they don't realize that. Next slide, please. All right, I always throw this up, and this is the second last slide. I always want to tell people about it because there's a lot of scams out there. We know there's a war going on. It's still going on in Afghanistan. And everybody wants to do their part and help veterans and give money. It's real easy to drop $1 in the bucket as you walk into Bueller's or Walmart. Make sure you know who you're giving your money to. There's a lot of groups out there. There was that Navy group, I don't know who it was. They caught the guy in Florida. He got about $15 million out of the state of Ohio. They have no idea how much he got out of various states around the country. And this hurts the people that are collecting money for the good causes, okay? Know who you give your money to. If you don't know that organization, do some research on them. If you don't know the person with that organization, keep your money in your pocket until you find somebody to give your money to. That's what I tell everybody. A lot of these groups, they prey on our elderly people. Aid and attendance is one of the pension programs. It's huge. They're always trying. There's financial planners, there's lawyers, there's insurance agents. All those people out there are trying to get money from our seniors, and they're pushing this aid and attendance thing that the VA has in order to get those people to buy things that maybe they don't need to buy. DD-214s and your discharges. I've seen on the internet where you can get a discharge. We'll get it for you in 3 months. Hey, pay us $15. Then they mail you the form that I would have you fill out in my office for free. You mail them the 15 bucks, they pull it out, put it in another envelope, mail it off to St. Louis. Don't pay for your discharge, okay? The only time the government will charge you for a discharge is if it has been archived for more than 60 years. And if you need it for a VA claim, I'll get it for free, okay? So come and see me if you need your discharge. Funeral homes, there's a lot of veterans certified funeral homes out there. I have no idea what being veterans certified means to a funeral home. So just beware. Just about any funeral home will offer a discount for a veteran. You don't have to go to a veteran certified one, go to the one of your choice. And that's about it. Just be careful who you give your money to. Next slide. Okay, I'm not going to take questions at this time. I'll take them at the end, and I just want to thank everybody for coming today. Thank you. Remember, he's my boss, so.
Thanks, Ed. At this time, we have Tom Burke, the Vietnam Veterans of America State President. He will explain new research for future generations.
Good afternoon. I know you're alive out there, just don't fall asleep on us. I want to take a minute just to say something about Mr. Ed's presentation here. I've listened to a lot of VSOs and people that talk about conditions for Agent Orange and so on and so forth. I got to tell you, I've listened to a lot of people. This guy knows what he's talking about. Ed, stand up and take a bow. I've got another fellow that's going to follow me here, Joe Jennings. He's a National Service Officer for VBA, and he knows his stuff too. Now, my topic is supposed to be new research and future generations. Now, that's a great thing to talk about. You know, it's interesting to me that we have a chemical that was designed to lay waste to the jungles of Vietnam and Southeast Asia more than 40 years ago. And what was its purpose? Its purpose was to destroy the lives. Its purpose was to lay waste to the jungles. And unfortunately, it's still destroying lives of veterans that were exposed to it today and descendants. The effects of Agent Orange are still being felt by decades after the military stopped using it, where the enemy was hiding in Vietnam. Veterans have been fighting for years to get the government to recognize the damage the chemicals had caused to the men and women who served in Vietnam. And something I am going to talk about today is future generations. Now, when I start talking about that, you parents out there, I want you to listen to this because it's very critical and it's something that VBA National has kind of fallen upon. And the reason I know about it is because another hat that I wear is that I am the national chairman for VBA National Public Affairs Committee. So I get exposed to a lot of this stuff. Now, one of the things I was asked was to talk about new generational research. Well, unfortunately, the last research that was done on Agent Orange was back in '96. There have been no other researches done since then. Now, I've got some paperwork here that says Agent Orange and related research. I've gone through this, and one of the things I want to talk about is the CDC's birth defect study, and it says Vietnam veterans' risk for fathering babies with birth defects. Now, this goes into the future generations, our kids, our grandkids. What's happening to them? I don't know if any of this is happening to any of you out there, but I can tell you that there are kids out there that are suffering defects from what we were exposed to in Vietnam. This study that I'm going to talk about, or I talk about, was conducted by the CDC back in '96, the Department of Defense and the Department of Health and Human Services. They assessed Vietnam veterans, specifically males, and their risk for fathering babies with major structural birth defects. Information regarding military service in Vietnam was obtained from interviews from mothers and fathers of babies in case and control groups, from review of military records. Vietnam veterans did not have, this was their conclusion, okay? Vietnam veterans did not have an increased risk of fathering babies with defects. Vietnam veterans who had greater estimated opportunities for Agent Orange exposure were not at a greater risk for fathering babies with all types of defects combined. And this was published by the Journal of the American Medical Association back in '96. Now, VVA National has kind of stumbled into a thing that we call Faces of Agent Orange. How many of you have heard about that? Anybody? Oh, we got one out here at the panel. Okay, Faces of Agent Orange is a program that VVA developed really by accident. We had been talking about things that happened to Vietnam veterans, us, okay? Then somebody started talking about, well, my kid has this, my kid has that, and all of a sudden the light came on and we said, what the hell's going on here? Now this was about 2, 3 years, 4 years back. The more we talked about this, the more we realized that something was happening out there that we had not really talked about. So we started asking our members, do your kids, have they been exposed to anything that you think was related to Agent Orange? Well, that was a key. Boy, it was like turning the lock. We have stories like this, Faces of Agent Orange, okay? There are hundreds of these stories. The VA does not take the time to look at these, okay? Now, what I want to do is take a little time. This is one story. This is a guy by the name of Gary Jones. Gary Jones is a native Ohioan. He used to be the national chairman of the PWMIA committee for VVA. He was one of the guys that brought this to our attention. Now it says, for Gary Jones, the puzzle that is Agent Orange can be explained, or more to the point, not explained by 2 words, circumstantial and coincidental. The problem with all the Agent Orange discussion is that everything is circumstantial, says Jones. We can't prove anything, but after a while, the word coincidence just doesn't seem to work anymore. He pulled 2 tours of duty in Vietnam, 1 blue, 1 brown. All you Navy guys know what that is. The first for a young naval officer came in deep water off the Vietnam coastline. The second came inland in the brown water of Cam Lo, near the DMZ. He worked delivering supplies to the Marines. My job, he says, was kind of like being an old Red Ball Express, but on water. Before Jones returned to Vietnam as the Vietnam Veterans of America in recent years, the dominant memory of the country for him always came with a reddish hue, not the deep, rich green that stretches across Vietnam as far as the eye can see. For many years, Jones congratulated himself for escaping the lingering effects of the chemical that brought so much misery to the lives of others. Then several years ago, he noticed a rash near his ankles. It would come and go, but it was never above the level of an irritant. Then I had a pretty substantial breakout up and down my legs. And they did a biopsy on it and came back as psoriasis-like. It's basically immune deficiency disease. In the most critical cases, it can become neuropathic. A year or 2 ago, I started getting pretty sick, and it turned out that I was dealing with neuropathic syndrome that attacked my kidneys. He goes on to say that his oldest son, this is where it comes into the parents here. My oldest son developed the same rash, but not on his legs, in his chest. His youngest son battled a series of attention deficit disorder that still plagues him. Neither Jones or his wife knows of anyone in their immediate or extended families with either of the medical diagnoses given to their son. I don't expect to go to the VA and have a conversation about this, Jones says. I'm already being compensated for PTSD and a hearing loss. At one point, I decided to go in and talk about it, but I decided I needed to get a lot more evidence and a lot more of the story before I submitted anything. But I planned to put it on my record. He said he had no complaints about the VA and in fact called himself kind of an advocate for the VA because he's heard all the horror stories about the VA care and says he believes them, but he also believes that in a larger picture, the VA provides good health care for veterans. He said the statistics, and this is very true, statistics show that 80% of veterans do not use the VA. He would like to see the VA work closer with civilian doctors so that general practitioners will be more likely to make inquiries of veterans. In all the intake interviews, Gary said that he went to several doctors. And in all the intake interviews that he did with civilian doctors, not one asked if he had served in the military. Not one. Jones wants the VA and the government in general to recognize that men and women in the armed forces are routinely exposed to toxic situations rarely faced by civilians. There should be a general health program where these people are monitored throughout their lives so that the problems that are not only proven to be connected to their service, but are probably connected are watched. We need to stay on top of these situations so that someone connected to military service and something arises that they can quickly respond to it. Jones doesn't think that the VA can do this by itself. He sees a need for civilian health professionals to be part of the system. If what I'm suggesting is too much for the VA to do, and I'm inclined to think that it is, then the civilian medical community should be supported to take care of veterans who are not in the VA system. These Agent Orange guys are dying 30 and 40 years after the fact with no treatment. That should never happen. We agree. We have examples. I have hundreds of examples of Vietnam veterans and their children coming up with the same type of diseases that we were exposed to. Has any of you out there experienced any of this with your kids, or you think you have? I see some hands. Ladies and gentlemen, we need to hear your stories. What are we doing about this? VBA National, in case you didn't notice, we may be getting a little older. And the fact that we have maybe 10 or 15 years at the outside, that VBA as an organization may be around. What we need to do in order to get these stories heard is we need to press our states, our senators and our representatives to sponsor legislation that recognizes that our children and our children's children may have been given diseases that they don't deserve. Now, what is VBA National doing? We're actually preparing legislation. We've written a bill, okay? We've written a bill that's called the Veterans Family Preservation, Treatment, and Research Act of 2012. This is brand new. It was written last month. We're waiting until after the election to find a sponsor. These things need to be brought to the attention of your senators and your congressmen. We need to be advocates. We need to be advocates for our own self-preservation and that of our children. We are people who have been exposed to this chemical toxic defoliants. They need to know that we have kids that are in that same situation. Not necessarily exposed to the chemical, but they have gotten the disease because we were exposed to it. So, what we are trying to do is to alert folks out there and Vietnam veterans that this is a possibility. We didn't know how extensive this thing was until we started interviewing our own people. We have on film and on video lots of these cases where kids have come up with extreme diseases. And the only explanation is what their parents think is that it has come from their father or their mother if their mother was in Vietnam. Now, there was a study that I read from one of our Vietnam veterans in Michigan. His daughter had a catastrophic disease, and he said something about that his chemical nature, he thinks his physical being had changed from the time he went to the Vietnam to the time he came back. Now, supposedly, there was studies made before he went over of his brain patterns and all that stuff, and when he came back, they had changed. Now, whether that is, that's obviously not proof positive, but it shows that there are things that may have happened when we were over there. So, I would like to indicate to you that advocacy is something that we all can do. If you speak to your congressman, you speak to your senators, you talk to them about these things. If your kids are involved in this stuff, you need to talk to them about that situation. I'll take questions after the rest of them have come up. We need to talk about that. We need to let them know that we are serious about this kind of situation. So with that, I will say thank you very much, and nice talking to you.
Okay, our last speaker this morning, Joe Jennings from VVA National.
What I want to talk about is this, what the doctor talked on. Dr. Birdsell did a very good job of explaining what chemicals or what diseases are in a medical terminology. VVA has put out this book, Service-Connected Disability Compensation for Exposure to Agent Orange. It puts into layman's terms what the doctor gave to you in medical terms. And what is listed here are possibly 14 different types of birth defects currently not recognized by the VA, but currently being experienced by the progeny of Vietnam veterans. The other side of what Mr. Destro said, yes, he gave you the technical chemical makeup of the dioxins that were found in Agent Orange. If anyone here ever took chemistry, you know what the half-life is. Half-life of Vietnam veterans' chemicals that were used in Vietnam can range anywhere from 25 to 250 years, which in layman's terms means the day that it was sprayed, 25 years or 250 years, it'll be half as potent as it was the day it was sprayed. There are places in Vietnam that are still not growing vegetation. There are birth defects in Vietnam that we have not begun to see here. Granted, we left 40 years ago, but the people in Vietnam, they had no place to go. They're having children born with no noses, no ears, deformed appendages, learning disabilities. All of this is going on now. This would be a perfect laboratory for either our government or the VA to go in and study the effects of Agent Orange. They've got the live, I hate to use the term, but the live guinea pigs. Just like we here in the United States, they only have us to deal with, the veterans that were there. Now we're beginning to see our children, our grandchildren, our great-grandchildren. And if you know anything about DNA, yes, DNA is the building blocks of life. But those building blocks of life create the chromosomes that both male and female pass on to their children. Once a chromosome or a cell has mutated, it cannot be changed. It can only be passed on in its new form, i.e., children, grandchildren, great-grandchildren, great-great-grandchildren. The medical evidence that Tom talked about in the faces of Agent Orange, we are now seeing fourth-generation children of Vietnam veterans being born with the same problems their great-great-grandfathers had. Like I said, this could go on for 5 to 7 generations. And the legislation that Tom talked about is one way where we can all become advocates. Without ever having to go to Washington or to your senator's office or your representative's office. Simply pick up a copy of that legislation and mail it to them. It'll cost you 46 cents now? 46 cents. You don't even have to sign it. But this is, in reality, if every representative from the Ohio delegation gets the same request, he's not going to read it, but his aides are. His aides are going to have lunch with other aides. They're going to talk about, did you get email today? Yes, I got this letter from wanting us to propose legislation. By coincidence, I got the same letter. If every congressman gets that same letter, somebody's going to bound to say, there must be something to it. Let's go talk to these Vietnam veterans and see what the real story is. You may become their point of contact here in this county or in this district or in this state. But if everybody does their part, whether you be a Vietnam veteran, a relative of a Vietnam veteran, just make sure that somebody is aware of what may be happening, or actually what is happening, to our children, grandchildren, and great-great-grandchildren. Let's say, suppose a senator or representative has a daughter, a child, who then has a child of her own, his grandson, who meets the granddaughter of a Vietnam veteran. They have a child. That child could be born with a disability related to Agent Orange. Who's going to pick up the bill for their medical treatment? Who's going to be responsible for that child if it's born with a learning disability? These are all things that are going to happen long after we're gone. But our legacy will have to deal with it. Unless there's legislation on the books that will track, I don't have to necessarily say compensate, but at least provide medical treatment for our progeny to make sure that they are taken care of, just the way that we're trying to get taken care of now for our disabilities. Granted, they may not get money, but there should be free medical service provided to them.
For the playing of taps. That concludes our symposium on Agent Orange.